Hi guys, my name is Timothy Meyer. I'm a psychotherapist and the assistant director here at the Lukin Center. I'm here with Dr. Elissa Gross, who is also a therapist here at the Lukin Center. Today what we're going to do is we're going to show a little bit of a demonstration of EMDR, bilateral stimulation. The reason why we wanted to make this video is because we have had lots of experiences of explaining EMDR to folks, and we get a lot of questions of like, what does it actually look like? So we wanted to come up with a fake scenario to demonstrate some of the mechanics of the EMDR phases that we get the most questions about. So hope you enjoy. Okay, so today we're going to be processing that memory of your parents yelling at you when you were a young girl, right?
Mm-hmm.
Okay, so would you be able to tell me the image that represents the worst part of that memory?
I think the thing that stands out the most is the image of me in my room crying alone.
Mm-hmm. When you hold that image of you crying alone in your room, are there any negative beliefs about yourself that feel at all true right now that go along with that image?
I think what comes to mind is like I'm bad, or I'm a bad daughter.
Okay.
I'm a bad kid.
Okay. Is there a belief that you would prefer to feel about yourself that would go along with that image?
Because I would like to believe that I'm good. I'm a good daughter. I'm a good person.
Okay. As you hold that image in your mind of you alone crying in your room and you say the words to yourself, I'm good, I'm a good daughter, how true does that feel on a gut level on a scale from 1 completely false to 7 completely true?
Probably like a 1.
Completely false.
Yeah, not too true.
Okay. As you hold that image in mind and you say the words to yourself, I'm a bad daughter, what feeling comes up right now?
Like shame, guilt, sadness.
Where do you feel that in your body?
In my stomach.
And right now, how strong is that feeling from 0 to 10?
I would have to say like an 8. Pretty strong.
Okay. Can I ask you to take the image, that negative belief of I'm not good, I'm a bad daughter, and those feelings of shame and guilt, and can you go with it?
Let's do it.
Right? Hook him up.
I just had this memory of my mom being outside my door, like calling my name.
Go with it. Hook him up.
I remember I thought she was, coming back to yell at me some more, but I think she was more concerned that I was all alone in my room, because even though they yelled at me, they didn't want me to be upset and alone.
Okay, go with it. Hook him up.
I guess maybe I feel, I don't know, a little better, like just that when she came to, talk to me or was calling my name, it made me think maybe I wasn't like the worst daughter ever, like, because she was still a little concerned about me, even though she was mad at me.
Okay. Would you be able to go back to that original image for me? Can you get that back up?
Sure.
Do you notice any disturbance?
Yeah, I still feel like a pit in my stomach, kind of.
Okay. 0 to 10. How strong is it?
Maybe like a 6.
Okay. Go with that 6.
Okay. Can I close my eyes?
You can. came up?
I was thinking about how, like, even though my mom came to my room, I felt like I couldn't talk to her because I was so embarrassed and like ashamed of like what I did. I just couldn't think of facing her.
Okay, go with it. What came up?
Just kind of like a lot of like anxiety kind of feelings in my stomach. I don't know. Not really any images, just a feeling.
At this point, what I'm going to ask you to do, I'm going to ask you to cross your hands like this and keep your hands on your shoulders.
Okay.
And I want you to, as you go with it, I want you to tap back and forth.
Okay.
Okay?
That?
Yes. So take that feeling of that anxiety and a little bit of shame that you were feeling before. I want you to take that and I want you to go with it. Okay. What came up?
I just had this thought that, even when my kids screw up, I don't think they're bad kids and I don't want them to feel ashamed or guilty. I want them to feel like they can be honest with me and tell me about it. And just kind of made me think that maybe it's not so horrible that I screwed up then and even now when I make mistakes.
Go with it. Okay. Okay.
I was thinking that like I would never say the things that I say to myself to other people, especially not my kids, but probably not any other people. It just made me think like self-compassion might be something I should work on.
Okay. Go with that. Okay. What came up?
I was just thinking more about it's hard for me to imagine being compassionate with myself, but I feel like I really need to try to do it because it just doesn't do me any good to always be beating myself up about these things.
Okay. Can I ask you to bring up that original image again? With that image in mind, do you notice any disturbance?
I think a little bit in my stomach still, like a little pit in my stomach.
Okay. 0 to 10?
It's going to sound crazy, but it feels like a 1.
It's a good one.
Yeah.
Okay. Can you go with that one?
Yeah.
What came up?
This is going to sound really crazy, but the song Survivor just came into my mind. I'm a survivor. I just have to, like, I'm not going to give up. I'm going to keep working on this. So for some reason, I just feel more like energized to work on this.
Okay. What happened to that one?
Honestly, it kind of feels like it's a 0.
Okay. Go with that 0. Okay.
Because I was sort of thinking, like, it's hard to trust this 0. Like, could it really be gone? Like, but I feel like it is gone.
Okay.
It's weird.
Do you remember that belief that you said that you would prefer to have that we said in the beginning? Do you remember what it was?
I'm good. I'm a good person.
Yeah, right. I'm good. With the original image in mind, how true does that feel right now on a gut level from 1 completely false to 7 completely true?
Definitely feels more true than before. Maybe like a 4 or 5.
Okay.
Like something like that.
Go with that 4 or 5. Ready?
Okay.
What came up?
I was sort of just saying in my head over and over, I'm good, I'm good, I'm good, I'm good.
Okay. Go with that.
Okay.
What came up?
I had like some flashes of things that I've done over the years that were good, like for my kids or for clients of mine, or just at my kids' school, and just it kind of reminded me that like I am good. Maybe not all the time, but a lot of the time.
Okay. So, original image,
Mm-hmm.
I'm good. 1, complete false, 7, completely true. Where are we at right now?
I feel like it's a 6.
6?
Mm-hmm.
Okay, go with that 6.
Okay. Kind of feel like, you know what, on the whole, I am good. I have some flaws and make some mistakes, but I feel like I am good.
Okay. Did the 6 change?
Feels like a 7.
Awesome. So what you just saw was phases 3, 4, and 5 of the EMDR protocol. Phase 3 is the assessment phase, which is when Dr. Gross and I were going over those questions about what image represents the worst part, the feelings that come up, the negative beliefs, the positive beliefs, and the level of each. Then we went into the desensitization phase, which is where you saw a few different methods of what we call bilateral stimulation. So we started off with the eye movements. We also did a little bit of work with the hand buzzers, and we did a little bit of work with tapping. So what's important to note about that is any sort of bilateral stimulation can work with EMDR. It doesn't always have to be eye movements. So we wanted to demonstrate all of that for you. And then we went into the installation phase, which was when we were working to install that positive belief that Elissa wanted to have. And we worked to get the level of feelings all the way down to a 0, and we worked to get that positive cognition all the way up to a 7. So those are the 3 phases that we saw today. Elissa, what were your thoughts of being a patient?
It was interesting to be on the other side of it. I liked all the different, the hand, motion, and then also the buzzer and
Mhm.
tapping myself. I didn't like tapping myself as much, I'd have to say, but I liked the other things, and it was interesting to be on the other side of it.
I feel like when I'm beginning to go into bilateral stimulation with folks, I do try to see what works best for people.
Mm-hmm.
Sometimes folks really prefer eye movements or the buzzers or the tapping. So that's something that I like to just check in on, because I think that's true what you said. Like the tapping for some folks just doesn't really seem right.
Right. Yeah. And there's something about somebody else doing it versus yourself. You having to do it yourself during the session anyway. I sometimes teach people this butterfly hug thing to do on their own at home if they're feeling anxious. But yeah, and I definitely find that my clients have different preferences. Some people like the buzzers, and some people like the eye movements more.
Yeah.
So it's good to give them a range of options.
Yep.
Yeah.
So one thing that we definitely need to say is I wish EMDR worked that fast.
Absolutely.
What's really important to note is that EMDR is a protocol. There's 8 stages to it. We only went over stages 3, 4, and 5 here.
Mm-hmm.
So there's a lot done before this, and there's also some work done after this too. So the last thing that I want folks to get the impression of is that what you just saw is EMDR totally, because it's definitely not.
Right.
Elissa, would you be able to say a little more about what happens before and after? And
I would say, a lot of work goes into kind of the preparation for those, those stages, the history of, a person's history, and really spending time figuring out what would be the most useful things to target when you do the EMDR, and that kind of thing. And just making sure that people are in a good place to be able to do the EMDR, because sometimes it can trigger, thinking about old memories that are traumatic or upsetting can trigger anxiety in the present. And so we also want to spend time in some sessions beforehand working on, creating like a toolbox for people of skills so they can handle any anxiety or bad dreams or anything that comes up as a result.
I say to everyone that rule number one of EMDR is we need to take care of ourselves.
Absolutely.
And I think that means in session and out of session.
Yep.
Because we're really going into some of the most painful things.
Absolutely.
So if things come up that are too much in session, we need to be able to take care of ourselves here and also outside.
Absolutely.
And that's why, the beginning phases of EMDR, really working to implement all those skills that we keep in our toolbox is absolutely imperative.
Yeah. Agreed.
And that those beginning phases actually, I think, could be more effective than the actual processing sometimes, because really what we're doing is we're teaching skills on how to take care of yourself.
Right.
So sometimes I find that I'll go through the first couple phases with folks in 3, 4, maybe 5 sessions, and then maybe that's all that they need. Which sometimes
that is interesting. That's happened in my case also. Some people are like, they don't really need it, but then sometimes they go forward and it all complements each other. Right.
We're really bringing up so much, right? And we're really bringing up these images, and we're really going with them, right? So we need to be able to make sure that we're able to sort of kind of like come back, sort of bring it back, but put it away somewhere,
right?
So that way we're okay for the rest of the day, the week, until
so it's like contained more, and so it's not just like all over.
Exactly. Yeah. Which is super important, and all those skills need to be put in place before any of this stuff before we even begin to do any bilateral stimulation.
Right.
So the beginning phases and the end phases are equally as important as the bilateral stimulation phases, which I don't know. I just want to make sure that people know that.
Right. The other thing I was thinking, I don't know if this fits here, but just the idea that obviously we were doing a fake session to give people a sense of what goes on during an EMDR session, but typically you don't go from like a high level of distress to 0, and then from a 0, like a 1 of the positive belief to a 7 in like one session flat. Right. It's usually it can often take several sessions.
Right.
So process.
The way that it works most times with me anyways is, we might start with a high disturbance, maybe 8, and we might get it down to like a 4 or 5. And then we pick right back up with that 4 or 5 next time, right? So, more often than not, it does take numerous sessions, even on one singular memory.
Right, exactly.
Because there can, I feel as though these memories, they have so much embedded in them, and I feel like memories can find their way to attach themselves to other memories.
Absolutely, they kind of link together and form like a bunch of like connections in that like negative direction.
Yeah. So typically it does take more than one session to process and sort of get to where we want to get to with the memory. If it works as quickly as what we just did here, that would be great. But
magic.
There's a little bit more to it than that.
Right.
Also, I guess I just wanted to say something about, we didn't speak much in our demonstration.
This is a good point.
And we did that purposefully because with EMDR, I feel like people naturally want to talk so much about what comes up.
Definitely. People are very tempted to start talking about it.
And honestly, sometimes I am too.
Me too. Curious.
But, the reason why I hold myself back and sometimes I might ask folks to not tell me all the details of what came up is because really the healing, the processing, the work is what's happening as we're doing the bilateral stimulation.
Exactly.
So I appreciate that we were purposefully very quiet.
Yeah, and that's so true. Some people find it really hard to wrap their head around it because they think of therapy as you talk in therapy. So it can be hard for people to get used to the idea of not explaining everything. But then there's some people who really don't want to talk about some of these traumatic memories. And for those people, this can be a really great technique because they don't have to tell you everything. They can keep it in their head. And I always think of it as we're kind of getting out of the brain's way. Like the brain needs to go where it needs to go to heal. And if we
Right.
put too much language into it and start talking too much, we kind of derail the process. So
Right.
I think it's really powerful without the talking.
Yeah, it's almost like we want to get out of like the like our cortical process of
Exactly.
like thinking and talking about it. I want your brain to be focused on like feelings
Because
and
this is, much more like connecting like thoughts to feelings and like getting to the gut part of it, right?
exactly. So
Mhm.
sometimes, if someone I might say what came up is like, oh, this like feeling in my chest. I go with it,
Right.
right? Because that right there is so raw and real and
Yeah,
so sometimes it could be like even as quick as that, like, oh,
absolutely.
the feeling changed. Okay, go with
Go
it.
with that, right? Exactly.
And that doesn't mean that we never say anything.
Right, right.
Like here and there, I might, speak a bit, but typically with EMDR, we want to stay out of the brain's way,
Exactly.
which I think that's a super important point.
Right. And with a lot of people, obviously the preparation phase, like you spend a lot of time talking about what memories you want to process. And like, people work through a lot of stuff, like when talking that through and figuring it out. And then afterwards, maybe kind of debriefing after the whole thing is done. So there is language that, is part of it and talking, but just that whole process is so powerful without so much language.
Right. It's not like you're going to go to an EMDR therapist and never speak to them.
Right. Exactly. Right.
Like there is talking
A
involved.
lot
for
of
sure,
talking,
but-
just not during those like stages.
Exactly.
I guess one thing that is important, I guess, to address because it's such a huge part of this whole thing in terms of the setup and the way it all works is, talking about the negative and the positive cognitions. The reason why we have people come up with like a negative belief about themselves in connection to that memory. And my understanding of it is that there's so many feelings that are linked up with the negative belief that comes from that experience. And then those feelings and that belief or those beliefs that we have kind of just stay with us in life. And then they kind of color our experiences in the present. So the idea is to target that negative belief to sort of get rid of it and clear it out and also get rid of some of those feelings and then kind of replace it with the more positive, more adaptive belief that you would like to have about yourself.
Right. And so in our example, right, it wasn't just about getting in trouble.
Right.
It's like
Exactly.
that negative belief about yourself was I am bad or I'm a bad daughter, right?
Right.
There's getting in trouble, but then there's feeling like a bad kid,
Big
daughter,
difference,
et cetera,
right?
right? So so many emotions and feelings attached to that. And it's
Right.
almost like I like to kind of conceptualize it this way. That belief and those feelings are sort of embedded in that story.
Yes.
And then that story is embedded in somewhere in our brain.
Exactly.
And sort of going back into it and really working on those beliefs and like how we feel about ourselves and then implementing what we prefer to believe about ourselves, right? It really does a good job of kind of rewriting that story and taking that that pain, that shame, that whatever it is away from it.
Yeah, and like shifting the belief. Like even in the fake thing that we just did, when I was the patient, my belief shifted from I'm really bad to, oh, well, I wouldn't tell my kids they were bad if they behaved the way I did that time. And like slowly I was able to shift from I'm bad to I'm good. Actually, I'm good in many ways. It was much more adaptive. Like that's the idea, I guess, for people.
It really like
have that experience.
It's almost like we use our brain now to like color in an old memory.
Yes.
Where we didn't have what we know now. And we're able to kind of really, like you said before, color in that story, which I think is
right.
It's great.
I had one I think it was the training that I did like years ago for EMDR. One of the people that was an instructor said something about it's sort of like, when you go to the dentist when you have a cavity, they dig out the decay and then they replace it with like a healthy filling that's like maybe medicated or whatever. So that protects your tooth. So he kind of used that as an analogy and that kind of stuck with me. I thought that was good. Kind of digging out like the yucky, rotten decay stuff and putting in something more, adaptive and healthy.
I never heard that analogy, but
Isn't
I
that
like
good?
it.
I like that
I
one.
think I'm going to steal that one.
Yeah, that was good.
So in conclusion, just as a quick recap, what you saw was phases 3, 4, and 5 of EMDR. Dr. Gross and I wanted to make this video because we get a lot of questions from folks about what these phases of EMDR actually look like. And so I really hope that this is helpful for anyone who is thinking about EMDR so that they get a little bit of a better picture of what it will actually look like in these phases of treatment. I think it's safe to say that both Dr. Gross and I really find EMDR extremely helpful, and we definitely recommend it when appropriate for folks dealing with difficulties. I want to say thank you so much for watching the video today. I again hope it was helpful. Again, my name is Timothy Meyer, psychotherapist at the Lukin Center with Dr. Gross from the Lukin Center, and thanks so much for watching.